Hi, I'm Julie Donnelly from the Julstro Muscular Therapy Center. I've developed the unique Julstro techniques to be a self-treatment system to release the muscle spasms caused by repetitive strain injuries. In this session of pain-free living, we're going to talk about a condition called trigger finger. Trigger finger is when one or more fingers won't go in the direction you want it to go in. So for example, you want to close your hand into a fist. Everything closes except one. And you try and you try and try and you cannot get it down. And eventually you try hard enough and it sort of clicks down. The other way, it could be that all of your fingers open up except one, and you're trying and trying and trying and trying, and then eventually it clicks up. It hurts when that happens. And it also means that you're in a situation where you can't really pick up a frying pan or a kettle or type. There are many things that you can't do because your fingers aren't moving properly. What's happening here, the way muscles are involved, is the muscles of your forearm all end up, they go into tendons right about here, and the extensor muscles go into a tendon. They insert on your carpal bones, and then they insert on the top of your fingers. And the muscles here are called the flexors. They go into a tendon right about here, or a group of tendons. They go through your carpal tunnel, and then they insert on the bottom of your fingers, at the tip of your fingers, but on the palmar side. When the flexor muscles contract, you do this. When the extensor muscles contract, you do this. If one of them gets into a spasm, you're not going in the opposite direction. So let's say that your hand is down, so the extensor muscles are contracted. You now want to pick your hand up, but one of those extensor muscles is too tight. And because it's too tight, it can't lengthen in order for you to go in the opposite direction. So you're trying to pick up your hand, and it goes like this, and one finger is stuck. It just can't go. Think about if you had a leather strap that came down and inserted right here, and it was tightened. You're not going until you release that tension. Once the tension is released, the finger goes up. I had a court reporter who was losing her career because she had to have all of her fingers in order to be able to type as fast as we can speak. She couldn't do that because her finger couldn't move. It took 2 or 3 times of working on the flexor muscles. Her finger was fine, and it saved her career. You use your hands constantly. They have to be free-flowing. I can teach you how to do that. Please visit my website, julstro.com, and also for these muscles, carpal tunnel treatment.org. And perhaps I'll meet you at one of the many clinics that I teach around the United States. Thank you.